just imagine that you are working as a nurse in a hospital or doctor's office, clinic, and a patient is throwing you up against the wall, or it takes a whole staff of people to have to jump on a patient's back or a visitor's back to take them off of you as a healthcare professional. And again, this is, a nurse who was detailing that story, but this has become, again, increasingly common in healthcare.
I'm listening to your show.
The point that there's limited news
I just
coverage.
want to know what your viewpoint is.
Because major news organizations have a hold on, what they can report on.
The people's voice. Welcome back. Welcome back. This is the people's voice. I am Trey Evans, and I am the people's voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we thank everyone who has taken some time out to listen to the podcast today. We do understand that you could be utilizing your time to do something else. So we do appreciate you spending your time equity with us today. As always, if this information is valuable and you find it to be enlightening, we do ask that you subscribe to the podcast. That way you'll be notified each and every week when we put out an episode. We put out a new episode each Friday, which can be heard on all podcast platforms. And then we also put out a video on YouTube on a weekly basis. We will be nailing down a day when we put out the video. I know we've been kind of a little bit all over the place in terms of premiering the videos. We're just trying to look at best landing spot for the video on a weekly basis, but it will be and has been on YouTube each and every week as well. But as always, we do thank you for listening and welcome to the People's Voice podcast. So today, I want to get into the topic of workplace violence in the United States. And I want to specifically talk about workplace violence because I think many will be enlightened. I don't want to use the word shock, but enlightened to learn which industry has the highest reports of workplace violence. And I know for me, I had some assumptions of, what that would be, right? I'm thinking, workplace violence, you automatically go to the assumption of the post office, right? Because the terminology, somebody's going postal, right? So I'm thinking, okay, well, maybe it's workplace violence in the post office, maybe it's police officers, but no. To my surprise, as I started to delve a little bit deeper into this topic, I found out that that is not the case. So today I want to talk about workplace violence and the industry that is most affected by it, private industry that is most affected by workplace violence is the healthcare industry. And this effect, if you will, has been going on for quite some time. So this is not a new phenomenon. The workplace violence in hospitals has been occurring in healthcare has been occurring for well over 30 years now, or at least 3 decades, but it is increasingly becoming worse. And post-pandemic, it has even become increasingly worse, but there's more reporting about it as well, especially with the utilization of social media, with people uploading, clips of different incidents and things of that nature. So that's what I want to talk about today. I want to talk about workplace violence and workplace violence in healthcare. Talk about, some of the incidents that have been occurring, some of the causes of it, and, what can be done by healthcare professionals to kind of prepare, if you will, to deal with these type of encounters in their facilities and other workplaces. So I got this. I was doing the research on this, and I pulled up a chart that was on the what is it? The Bureau of Labor Statistics, and the Bureau of Labor Statistics has a chart here where they are laying out the non-fatal injuries. What does it say here? The number of non-fatal work injuries in private industries. And in this, they have, several different industries, if you will, where they list, and this is reporting from 2021, which is, typically normal. It's typically like a 2-year delay before they post these. But in here, they have every industry from agriculture to utilities, construction, manufacturing, and they report the number of injuries or the number of non-fatal work injuries that have been reported. And it's in the thousands by far. And those of you who are watching the YouTube video, you'll be able to see this, but workplace violence, healthcare industry, healthcare, and specifically healthcare, the healthcare industry is by far has the highest number of reports of non-fatal work injuries since 2021. So data is out there to support, some of the claims, or I should say the incidents that have been reported over the last decade. And definitely, like I said, it's going almost 3 decades back. And some of these encounters are very violent. Matter of fact, let me play this clip from the CDC. They interviewed a panel of nurses, and I want you to hear the story of one of the nurses of, what she saw during an encounter, and then, we'll go from there. But let me play this.
I've seen one of my coworkers picked up and thrown up against the wall, and the patient going after her again. I've seen one of my coworkers jump from behind, and it took 7 people to get her off, the patient off the nurse's back.
That's got to be scary in any work environment, right? But just imagine that you are working as a nurse in a hospital or doctor's office, clinic, and a patient is throwing you up against the wall, or it takes a whole staff of people to have to jump on a patient's back or a visitor's back to take them off of you as a healthcare professional. And again, this is, a nurse who was detailing that story, but this has become, again, increasingly common in healthcare. And one of the other aspects about this is that this is occurring in healthcare, but a lot of times these incidents are occurring in healthcare, but often in industries that are dominated by women. Now, that takes on a whole nother scenario, but I wanted to point that out because, obviously this nurse detailed that, but in the reports, when you kind of drill down to it, these healthcare workers, this is happening to like home aides. This is happening to, physician assistants in clinics. And oftentimes these are women. So there's violence being perpetrated, not just in healthcare, in the healthcare industry, but oftentimes this is, being perpetrated by individuals who are perpetrating crimes against women. Now, I'm not saying, I don't want to, come off as, I don't want to say egotistical, but chauvinistic. That's what I was looking for. But you now have patients that are attacking not only healthcare professionals, but women who have decided to enter a field where they wanted to care for people, and now they're having violence having violence perpetrated upon them. So, that in itself is quite concerning. There was another statistic or another survey that was conducted by MD Links. MD Links is a website for physician professionals where they kind of talk about different aspects of being a physician in healthcare and things of that nature. But they conducted a survey, and on their survey, they asked the question about violence in their facilities. And they asked, have you seen violence against healthcare professionals increase? And literally 75% of physicians have said that over the past few years, they've seen a dramatic increase in workplace violence issues being perpetrated against healthcare professionals. So, again, I'm reporting this because, like I said, there's been some light shed on it, but I don't think there's been enough. So I'm doing my part to highlight this because obviously, listen, healthcare professionals are very important. I don't know personally how you can go into a facility and, I can. Let me back up. I can understand based on, certain circumstances. I don't want to be insensitive. But at the same time, keeping in mind that these individuals are here to help with the care of yourself or your family, it just really caught me off guard in terms of that this was occurring. So, what are some of the reasons why this is occurring? Right, I'm kind of highlighting that this is the issue. You heard from the nurse there, but what are the reasons behind it? Right, because for every action, there's a reaction, and there has to be a cause to create an effect. And so I'm reading an article here from Forbes.com, and they talked a little bit about this as well. I think, where is this from? I think this is from this year as well. This is from this year. So they did an article in August about this. And like I said, there's been some reporting about this. So, I don't want to make it like nobody's talking about this. But like I said, it's just been very spotty. So I wanted to kind of highlight it. But what are some of the reasons behind it? So here in the Forbes article, it says, and they're quoting from the American Association of Medical Colleges, it says, one of the reasons for the aggression of patients is anger and also confusion about their medical conditions. It could be the care that they feel that they received. And also, obviously, it could be just grief, right? I mean, listen, when you walk into a facility sometimes to go into a hospital or clinic, and, the news could be very grave, very ill. And, somebody might not have control of their emotions, and the healthcare professional is standing in front of them, and that's one of the first people they take things out on. But beyond just that, right? But some of the, I don't want to say, kind of the reasons that I think, prior to me kind of looking further into this, that I would think would be the cause of workplace violence. There are some additional issues as well as causing workplace violence in healthcare, in the healthcare profession, and against healthcare professionals. One of the huge issues, which I think is not being discussed enough, is the staffing shortages that are occurring in healthcare. Many healthcare facilities and the healthcare industry as a whole is really dealing with healthcare shortages, to the point where not only do they have a ton of people leaving, but they don't have a ton of people coming into the industry for various reasons. Matter of fact, let me play this. Piece from Dr. Ramin Davidoff. He is with, he's the CEO, co-CEO of the Permanente Federation, and he talked about this in an interview with the American Medical Association about the shortages in healthcare and some of the reasons that this is occurring. So let's play this, and then we'll go on from there.
So physicians experience psychological consequences, including burnout, post-traumatic stress disorder, depression, anxiety, and increasingly a willingness for all healthcare providers to actually leave the profession. Recent surveys have shown that 25% of registered nurses in the emergency department and in the critical care settings have experienced job dissatisfaction due to violence, and 25% are willing to leave the field because of this particular issue. And so the issue is really massive and profound, impacting care, quality, demoralization, and wanting to leave the profession which they entered, that we all entered, to help make a difference in the lives of the patients that we serve.
And again, so that was Ramin Davidoff. He's the co-CEO of the Permanente Foundation. But as you heard right from the horse's mouth, so to speak, not only are people leaving the industry, they are having a tough time in terms of recruiting, and it's kind of like a double-edged effect, right? There's staffing shortages, and a lot of staffing shortages. Like I said in the beginning of this, workplace violence has increased over the last 30 years, but it's been an exponential push since the pandemic because you had so many health professionals that left the field, just due to the stresses of the pandemic. But now you add on workplace violence as well, and you have people that don't even want to come back into the industry or already are contemplating about leaving the industry because of the amount of violence that's occurring in the amount of workplace violence that's occurring in healthcare. Some additional reasons why you're seeing a lot of violence in the healthcare industry, or at least workplace violence in the healthcare industry, has a lot to do with mental health disorders as well. It's been reported. I think I might have talked about it in a couple of podcasts about the increase in or the deficiency in mental health, especially coming out of the pandemic. A lot of people are dealing with issues such as anxiety and depression and things of that nature. So you take all of these issues, this gumbo of issues, if you will, and, you then have a clearer picture of why this is occurring in a profession where you would think the people that are tending to individuals would have an air of safety, if you will, right? I can't imagine, I'm not a doctor, but I would think that if I'm treating you to help you get better or to, help you get through a tough bout, that I would be seen as valued. And also, let me, be clear about that. When I say healthcare professionals, I'm not just talking about physicians and nurses as well. This is occurring with many other professionals that work within healthcare facilities. So, matter of fact, let me play this last clip, and then I'll get into some remedies. But there was an interview by Karen Coughlin, who is the chair of the Massachusetts Nurses Association. And she talked about this as well on PBS, where she talks about who else is affected in the healthcare industry. Because, again, it's not just nurses and doctors. And I want to make that clear. So let me play that, and then we'll get into some, some tips of what can be done to kind of change that. But let's go from here. This is from PBS.
Health. Is this across the board, though, in other facilities as well?
People automatically assume that all workplace violence incidents happen in emergency rooms and in psychiatric units. That is not the case. We are seeing workplace violence incidents across the gamut of healthcare, whether it's in home health or whether it's at doctor's offices, whether it's on a medical surgical unit, in maternity units, in post anesthesia units, you name it, we are seeing it.
You mentioned that it seems to be going up over the past few years. Are there reasons that you think account for this increase?
It's almost like the perfect storm. So nurses are dealing with the inability to provide care to the patients in the way that they would like to be able to provide it in a timely manner. If you have too many patients to care for, you can't get to everyone. You can't be in 10 places at once.
And that kind of goes to what
The
I
other
was.
thing is that
what I
there
was,
are,
I'm sorry.
we have learned there are no consequences.
Clip kept playing. That's kind of what I was speaking to previous to that, in terms of the staffing shortages. But as you heard her say there, this is not just occurring in hospitals. So I want to make that distinction clear as well. This is in clinics. This is in home aids. Again, this is down to the security teams that are in hospitals and the maintenance worker who is just doing his or her job, and all of a sudden the patient, becomes violent. It's across the board for anyone who's working in healthcare. There is a serious issue in terms of workplace violence that is occurring and has continued to occur for easily over a decade, and is only getting progressively worse. In terms of the type of workplace violence, let me just, talk about that as well real quick. They did a survey here. Again, I'm reading from MD Links, which is a healthcare provider site, a healthcare professional site. They talk about the types of violence, and they kind of ranked it in terms of percentages. And everything from vandalism to stalking to, sexual harassment, discrimination. But the biggest one was verbal abuse and intimidation. And I don't want that to go unnoticed, either. Obviously, we talked about early on the workplace violence injuries, but also there is a huge increase in verbal abuse and intimidation, with people saying they're going to come back and they're going to do certain things. And, there have been cases where, doctors unfortunately have lost their lives. I'm not going to detail all the stories, but if you Google over the last couple of years, there's been doctors and healthcare professionals. I don't want to stop saying doctors, healthcare professionals that have lost their lives to the hands of patients that have been in their facilities. But what can be done, right? We talked about, the issues, talked about some of the causes. Well, what can be done about it? And, I thought MD Links did a great job here in terms of giving some tips on what you should do as a healthcare professional, because, at the end of the day, we can bring as much light to the situation as we want to, but when you're in that position, you need to act quick and have something that you can rely on to possibly save your life or save yourself from being injured, or even your coworkers. So one of the first things that they note here on their site, it says, if you are a target of violence or threats, first thing they advise is keep your distance, right? And which I think is, a great piece of information. The first thing is, hey, let me get into back into a space, a safe space, a safe distance from the person that's in front of you, that's maybe giving off those verbal threats, or getting closer to maybe the security team, so you distance yourself from the initial threats. Always stay calm and work on de-escalation techniques. Now, a lot of this is often taught in healthcare, specifically, security teams come in and they teach de-escalation techniques. And obviously this is part of workplace training as well, especially if you're working in high intensity environments such as a emergency room or things of that nature. So one of the other things they say is stay calm, de-escalate, redirect, which I think is great. If you are encountered with aggressive behavior, tensions are high, you want to stay calm as possible. And that goes, in any workplace, not just for healthcare professionals, but you want to stay calm. You don't want to exacerbate the issue by matching energy, right? That's never going to work out. It says seek assistance to prevent or respond to violence. Again, kind of like I said, take a step back, try to see if there's security on site that can come and de-escalate, maybe additional colleagues. Sometimes numbers can deflate or de-escalate the tension or the attitude of the person that's showing the aggression. Press charges if you're assaulted. And I think that's a great piece of advice as well, because one of the other issues is that even though we're talking about workplace violence in healthcare, many times a lot of the injuries that occur are not reported to authorities. So now there's really no history, right, to support what is going on in these scenarios. And that information is important because now it puts pressure on administrators and, executives of these facilities and programs to start to look into security techniques to ensure that individuals working in their program or facility are not being injured as a result of working as a healthcare professional. It says differentiate between burnout supports and burnout solutions. While self-care like meditating and yoga is encouraged, relying on these methods is not enough. Self-care is sometimes considered victim blaming, but may be encountered productive in the long run. Seek professional help. And that's, again, for individuals, again, because part of the workplace violence can be twofold, right? Because, again, you have staff that are dealing with not only stressful situations, but they are severely stressed out. Burnt out themselves because they're working, multiple hours because of the staffing shortages, which, again, when a violent incident is brewing, so to speak, you may not have the faculties, to do all of the previous that I just mentioned in terms of de-escalation, in terms of taking a deep breath, in terms of, moving your proximity. You might want to engage, and that just might be because mentally you're burnt out and, that part of the training doesn't kick in. So definitely you want to do some self-care yourself to ensure that you're not, in this state once you get to the workplace. And then last but not least, it says take advantage of training. Security staff often hold training on best practices to address workplace violence, which, again, I highly encourage that. Again, and this is for any workplace, but for those of you who are working in healthcare, I think, if you haven't had those conversations with your admins or your executives, and if they don't have that in place, then you definitely need to ensure that, the training necessary to deal with some of these issues and incidents is in place. So if you are ever in that predicament, you can rely on that and draw from that. But that's what I wanted to talk about today. I wanted to talk about violence in the violence in the workplace, specifically in healthcare, because it's just I feel like I say this every week, but when I get into some of these topics, it's like, man, like somebody's helping to take care of you, but I don't want to judge because, again, like I said earlier, I know sometimes it's just certain circumstances and not everybody, reacts to the same circumstances as well. So, but this is what's going on. So for healthcare professionals, if you know someone, definitely, let them know about this podcast because this might be some new information for them. But as always, if you want to leave a comment, you can definitely reach me on any social media platform. I'm at I am Trey Evans on all social media platforms. And then you can reach me at Trey Evans on LinkedIn as well. And that's my time for today. So I appreciate everyone listening. As always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the people's voice. Tell somebody about the dream. Salute. People's voice.